Pregnancy should be a time of joy and not anxiety for the woman and her family. Do you want to learn more about pregnancy or have questions about fertility and reproductive health? Then join Dr. Linda Vanutu on Facebook and YouTube every Saturday at 4 p.m. on the Online Pregnancy School as she discusses pregnancy, delivery, and childcare.
Hello viewers, and welcome to the Online Pregnancy School. It is always a pleasure and an honor
Pregnancy should be a time of joy and not anxiety for the woman and her family. Do you want to learn more about pregnancy or have questions about fertility and reproductive health? Then join Dr. Linda Vanutu on Facebook and YouTube every Saturday at 4 p.m. on the Online Pregnancy School as she discusses pregnancy, delivery, and childcare.
Hello viewers, and welcome to the Online Pregnancy School. It is always a pleasure and an honor to come your way. This is a forum where we talk about pregnancy, delivery, childcare, infertility, fertility, everything that you'd like to know about pregnancy. My name is Dr. Linda Vanutu. Let's go for a short break. Welcome back. Knowledge, they say, is power. But when you have knowledge, it can also be a very good weapon for you. So if you don't have knowledge, you can become an easy prey or target for the attacker. So always take as much as you can so that pregnancy will be a time of joy and not anxiety or fear. Well, viewers, there is so much that one can learn about how a pregnant woman can stay healthy. But I believe that there's one area that we may not be thinking about when someone is pregnant, and that is to do with their mouth, their teeth, and other structures associated with that. So today it's an honor for me. In fact, it's a joy for me that we're going to talk about dental or oral health and how this plays out in pregnancy. And I'm going to do this with a colleague. His name is Dr. Richard Selome. He's a dental surgeon, but not just that. He's a specialist maxillofacial surgery. Hey, doc, maxillofacial dental surgeon. Have I said it right? Let's go to him and he will tell us who he is. So, Doc, you are welcome to the online pregnancy school.
Thank you so much, Doc, for the opportunity.
Yes. Please explain to facial surgery, a specialist. What does it mean?
Well, so a maxillofacial surgeon, let me break it down to the words that you hear. Maxillo means your jaws. So maxilla refers to your upper jaw, but then it's applied in a generic sense. So it applies to your jaws. And then facial means your whole face and its related structures. So a maxillofacial surgeon works on your jaws and then the facial and related structures. What it means is that, for example, if you're involved in a fight and you broke your jaw, we will take care of that. If you had an accident and you had cuts on your face, we take care of that. Babies that are born with clefts, maxillofacial surgeons take care of that.
What is cleft?
As well as cleft, that is when a baby is born with the lip that is split with some gap in between, or sometimes you see that the top of the mouth, which we call the palate, is also split and you see a hole in between there. That is what we call cleft lip or palate, but it may also occur together. Okay. So maxillofacial surgeons take care of that. We also take care of tumors and other conditions that affect the face, the mouth and its related structures, and the jaws and the bones. That's basically what we do.
It's good to know about this, so that when people out there deliver a child who has a cleft, they will know that this child can be sent to the hospital and surgery can be done. Doc, we'll be mixing the Fanti or Twi and English because people have requested for that. So I'll say a little bit about what you have just said. Amafo, inde oye menije dudu. Obi bakade na inde zabasam na yepede yeken. Nyinsan ohia papa. Yepede obi anyinsan na otsinde mebiase. Na ma za wobakade onye no waye. Na obenyinsan bo wie no na waawo waafa no ho waafa na ba. Inde menyim nua doctor kor na yezi dwumi. Inde ze yeba bakasa afa itir enum ese na nyinsan no ho. Obi bodwinde na yesu do ofa ho we ofa ho papa yebo wie na ya atase na nipa me didwume wo friend Dr. Richard Selome na onu brofo no what's there or your dental surgeon mona we wa kire hon mosi wo hwe senade no na neze no nso hwara maxillofacial wa kire hen ye na abodwi na he na enyim nzema okodo we num na ade nyina no onu wa hwe ho oye na wo wafre bebi a ebonde na ekam da nenum ehwe nenum esoro ho ebonde onsu ekwanda ho ebi so ana na ano da ma abofra no wo na mpocho me nkoto ne nchen wa chechire binum a wo betum wa hwe na wa ye ho operation na ama ho ma wa kandesi na wa ye fefefe se ehun fanyi ni bi obi ne de ansa na wo be na operation na wo ye ni wie na wenyu obeje nti no nde doctor me didwume dam na oye yebo wie ne yebo hu bebi owo nti senyim obi a owo dam hawnum a mepocho fa no koho na wonhwe na wonye man pepepe obobo he nyina pepepe. Doc, oral diseases, are there challenges with them? Is it a major problem that we should know about? The magnitude of oral diseases globally and also in our country?
Yes, indeed, they are very, very common diseases. And indeed, the WHO estimates that almost every human being at one point in their life will have an oral health condition, dental pain, whether it is some tooth that is mobile, whether it is a cracked tooth, or whether it is just white in the mouth or any of those things. The WHO estimates that almost every human being at a point will have some. In Ghana here, in 2017, from the study a colleague conducted, he found out that about 95% of of people that he spoke to either had a condition or has had one tooth removed or has had a treatment done for an oral condition or the other. The usual thing is that because, how do I put it? We don't see it as a serious condition in that if you had malaria, you would have been stuck in a room. If you had a toothache, you just say, I am not sick, I had a toothache. So we don't see those things as serious in that sense. That is why we don't attach much importance to it. But however, they are very serious in the sense that some can kill you if you leave them untreated. Even if it doesn't kill you, it gives you sleepless nights. Imagine if you lost all your teeth and then you have to even apply for certain jobs. You can't get those jobs. Imagine be a newscaster and you have your front teeth all gone and you're on screen. So they have serious implications, and they are very real conditions that we deal with on a day-to-day basis. Indeed, the WHO themselves also estimate that tumors that affect the jaws and the mouth are even more common than leukemias, and then certain cancers that we even give more prominence to.
Wow.
So this is something that we have to take more seriously than before. Yeah.
Then that is a serious matter. Because if you ask anybody, I'm sure everybody, as you said, over 90%, because everybody has had one tooth problem or the other before. But you know, if it doesn't hurt in the night when you couldn't sleep, then when you wake up in the morning, you will not even bother. Oh, it's just a little tooth problem. But we are happy that today we are learning that it is so common and we have to take care of that. So somebody might ask, what is oral health?
Okay, so essentially, first, let's look at what is health. I try not to define oral health in isolation when I'm speaking on these issues, because it looks like you can't. Nanso no WHO a ɛyɛ ekuo a ɛhwɛ apɔmuden ho nsɛm wɔ wiase nyinaa no, ɛka ne sɛ yɛka health a ɛkyerɛ sɛ that state of complete physical, mental, social well-being, not just the absence of disease or infirmity. What this means is say uhunam no mu na uhu no ɛne w'adwen mu ɛne sɛnea wositi kromo hɔ anaa omiabea bi a wɔ oni oyɔnko ho nkitahodie ho nsɛm nyinaa no, sɛ wo ahotɔ wɔ saa nneɛma ɛwɔ mu nyinaa mu a ɛne ɛka ne sɛ wo apɔmuden. Now, to bring this to oral health also is that if your mouth is not well, you can't say you are well, because your mouth is part of your body. And then this means that you can be well, all right, physically well, you can be socially well, but then if you have a toothache, what it means is that you are not well, you are sick. So essentially, when we say oral health, what we are also saying is that the well-being of all your mouth and its related structures that help you to speak, that help you to chew, that help you to swallow, that whole complex should be in good health and should be able to allow you to perform the functions without pain. And that is what, when we are talking about oral health, it encompasses. So as I said, you can't say you are well when your oral health is poor, because your mouth is part of your body and affects your body the same way your body also affects your mouth.
If you like a particular type of food that you need to chew, you don't just have to swallow, and you have a toothache, you cannot eat. And if you have any challenges in your mouth, you can eat malnourished, because there's no way you can eat. So it is very, 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 very important. We cannot take it out of health. So Doc, having said this, how often should somebody visit the dental surgeon? Because for a lot of people, they only go when they cannot stand the pain. But how often should we go?
So the truth is that because most of us don't visit the dental surgeon, there are almost always problems that are ongoing until we visit and it is found.
Yeah.
So just like we maintain our houses and then we pay insurance on our cars, we advise that at least once in the year, you must see your dentist, at least once in the year. But we advise that on a regular basis, every 6 months, at least you should visit your dentist. It does not mean, say, okoya na obutusi. Na yakoye feeling biama anase bibia. Ansha na ukompo ahwini ho. Eno sta na wetu for say oh, ni awo ye no koso aye. Anase se bibi wo hompo a obehu achro. Empempi no ti say kaka a esi nkofo simu a ye friend dental caries no. Sha ase a empempi no wonte yawo.
Okay.
O start te yawo anase o sha ase te yawo and o kire say akọ adu echi nti na wa sha ase te yawo no. Enti no enkai ade a wo kontem a ebi obi timi ba obehwe ne na ntokro be miensa bi wona sem kra onhui obeka che so doctor say na nya me yawo me hu se toko bi ada ho but enu nti na ye che se obe hospital akwa ma o dentist ahwe wonu ahwe bibia se den na koso ebi nso wo ho metimi a kire be busumi mienu echi ni ma me bi ba ye ho ono okaze ne sen ebu na ode bae na ehwe no ye hwe no mu no na me hu se no bibi nso ahono na pantai no enchen sesei na mbisa na se wehu ana o se ono de ohun ye na me se o ya dress kra ohun bibi se bibi aba ha so ohun bibi asa na me se okay me hu se bibi ahono e wo dompe na so ntina be hia se be nhwehwe mu bi mu ye koye nhwehwe mu no na ye tumor otokasem kokram yare cancer akankasem ye kan kokram yare ye nhwehwe mu wie ye no jamencha de na nidi nko ekire bebre ye no operation eyifi homan one man hospital in Tema anka na ebeka akọ ekire ama anhwe ana akọsẹ nyama bebre nti osumi nsie bia no ye kire se wo ana so say wentimi at least once a year at least so do.
Wow, that is good. Doc, so now at what age would you recommend that we start visiting the dental surgeon? From what age? At what age should a family be concerned and start sending the children to the dental surgeon?
Well, as we said, anything could be wrong or could be right, all the way from birth to death. Whatever it is, at least when the child is about to, should I say, bring forth his teeth, typically around the age of about 6 months, all the way to when you die, you should be coming to see your dentist. However, sometimes you realize that when the child is born, the midwives do a very good job. Sometimes they may miss some things which may show up, or when the mother sees some things that are not right. Like as I was saying, for the cleft palate, babies that have cleft palate, they have that hole at the top of their mouth. You are feeding the child and you realize that the milk is leaking through the nose, which normally wouldn't be. Or you realize that the child is not able to suckle because there's that thing under the tongue that holds the tongue, and the child is not able to protrude the tongue or move the tongue. Or you notice some swellings in the mouth that the child was born with, or different things. Those ones, we won't say that wait until the child is about 6 months. So just around that time, we advise that you start coming to see the dentist.
Very important. Amanfo, there's a year can want me or yeah, often it's still a num, a saint in a za obetum waba. Ansa na yebeka ma osi wo apemfu ho mu ye pede ye tase o sende nye hemu bebre na ya akwa dentist ho wo sen oye wo efe da na echa na da ese medinchinu gunshum na me de gina menum oyem oje ya pe na me da afa dum ko enkwa dentist wa che hende ma mi bi ono be no o sen ho apan wo hwe ne na sa na kokram wa ahase wo baby wan koda ma bere na nche wo hu wo bo hwe no na wa akwa echi. But the interesting thing is that when a baby is born, we've just been told that baby has to be examined very well. So if you're a midwife who has delivered a baby, please don't just look at the baby outside. Look into the mouth. Make sure everything is okay. before you let this woman go home and say that all is well, please. And so if you're a pregnant woman, it will be good that you deliver with somebody who has been trained to take care of pregnant women, so that when you deliver, they will do the necessary checks to make sure that your baby is fine before they let you go home. If there's any reason why that child should be sent to a dental surgeon, then that will be done. Please, let's go for a short break. Welcome back. Please don't forget that this program is proudly sponsored by Promise Ghana. First up, if you're having any party or any gathering, invite them. Their number is there on the screen. So invite them and you'll be happy. Samzara Ventures, manufacturers of Bubble Gold liquid soap. You know, we are still in the COVID season. Although some people think that it is gone, it is not gone completely. So don't lose your guard. Wash your hands with soap under running water and use Bubble Gold liquid soap. The program is also sponsored by Erama Clinic. They offer you very good services, public health and clinical care. They can even come to your home and see you. So call them and do business with them. You'll be very happy you did. My guest for today is Dr. Richard Selome. He is a dental surgeon, but a specialist maxillofacial surgeon, and he's explained to us what that means. They take care of your head, your mouth, anything to do with that, your teeth as well. And today we are talking about the oral health and pregnancy. But before we get into pregnancy, we want to understand what we need to do. Young children, men, women, everybody. It's not just the pregnant woman, but all of us have to understand the role that they play in our health. Because if you have a challenge with your mouth, it will affect the whole body and your reaction to everything. So it's important. Doc, please, are there foods or drinks that the general public should be aware affect our oral health? Before we come to the pregnant woman, we want to understand what the general public must be doing. So are there foods or drinks that we should be careful of, and other substances, anything that will affect our oral health?
All right, thank you very much. We always say what the nutritionist will tell you: eat healthy. And eat healthy means these days we talk about natural foods as much as possible with high fiber content, fruits and vegetables. Now, there are specific foods that may have direct impact on your mouth, like the acid containing foods, like the fizzy drinks. Okay. These tend to wear away your teeth because acids have an effect on your tooth. Then also those foods that are very sticky. It is not necessarily because you shouldn't eat them, but the time you eat them and what you do after you eat them is what is very important. Okay. So those of us who like kelewele is nice, but you know that when you're eating kelewele, now kakrebia koshel simu, and now we plantain chips, and then you'll be trying hard to get it out. Now the important thing is if you eat that during the day and you brush well and you take good care of your teeth, it's not a problem. But if you eat it at night and then you are not brushing and you're not taking good care of your mouth, what that does is that over time, the bacteria that is in our mouth, which God put there, which we call normal flora, they live in their normal environment, but they eat these things by working on them, produce certain acids and certain substances that begin to destroy your teeth. and then also your gums. So such sticky food, we advise that if you want to eat them, then make sure that you are brushing well after them, and then you reduce the rate at which you're consuming some of these things. Then good foods like fiber containing foods like fruits. Now we are not saying fruit juices, I'm saying fruits because we are talking of the raw fiber, the roughage in them, which tends to help clean your mouth as well. And then also it helps with digestion and other things that the general physicians will tell you. But then for us specifically, what that does is also helps clean your mouth, also maintain the balance of the pH in your mouth and things like that. So generally with foods, eat healthy, and then also eat at the right time. And then what you do after eating, like taking good care of your mouth, brushing on time. If you cannot brush, then we say that at least just take some water into your mouth and then vigorously rinse and swallow it. So we say swish and swallow. Than if you can't not brush at that particular moment. Maybe you're at a conference or a meeting and Kelewele is part of the jollof. And so you just rinse heavily so that at least it takes some of it away. And when you go home, you can go and brush very well. Those are some of the things. We also encourage that good food containing calcium, like the seafoods that we eat, egg, milk, all those things are good for us. Then also in the right quantities as the nutritionist would advise.
Just what on anufa? Kelele no ya anufa oye dawso and I'm wanted to listen to na Yabako akoto obi every evening you to kelele.
Yeah, but near here ne say mpempi no niama na yepe ye de no eno anso na se be ye papa mo kire say eno anso na etimi kunye. And you know, what's important is that we take good care of our teeth after we eat them.
Yeah.
So the sweets, the toffees, the chocolates, the stick, and as much as they are nice, the important thing is that we must reduce their intake. They have other impacts on our body, but we must reduce their intake and then take very good care of our mouth after we are important.
Thank you very much. There are some people who want to take fizzy drinks. Them colors, insano. Is the baby obezi be opedo di binom. Opedo di ka ho. Onom no didi. Obi so no di. So didi na ebi nka ho a ontumi ndi. Nda wo se. Them insano otumi na oha wo hene sen. Na ye already already. Ewi a emboa no mo huhuru na enum nso. Na why how na he na ye paso otum okeka sim no de bo hohuru we num na no we ntum na wan ko na we ndi the madi na to the pregnant woman. But before we do that people bring to the hospital that we should be aware of.
Yes, so the most common that people refer to is what everybody calls kaka. My name is Kaka Nadia. If you are Kaka to me, any pansa, a bit me canepe, a bit me cababy, about where the Kaka and numodiano. And that is what we call dental caries. That's where you have cavities in the teeth. As mild as just having a hole in your teeth, and then as serious as becoming an abscess and then damaging your health and can kill you. So caries is one of the common ones, and then forming an abscess, your jaw can swell, and then it can go all the way to affect your neck, and then sometimes go all the way to your chest, anywhere that the abscess can spread to.
Wow.
And then what we also call periodontitis, or the diseases that affect the tissues around your teeth. So when you take a tooth, for example, let me use a pen. It is in the bone that way, held in the bone, and then this is the bone, and then the gum covers it nicely. I forgot to pick a more. That the tissues around your tooth are the gum and the bone, and the diseases that affect them are also the common ones that can also come. So the person starts complaining of bleeding gums, my tooth is shaking. Sometimes they will tell you that they even lose a tooth, and particularly in pregnant women in the past, not almost say, I will be bakutu.
Yeah.
Those are also common. And then there's a sore in the mouth, it's not healing for a long, or there's a swelling on the jaw, or there are other things that, those are some of the common things, but caca and then the periodontal conditions are the most common among them.
Smoking affects the oral health.
Oh yes, smoking affects it in so many ways. Smoking, first, is the physical heat and the air that keeps passing by. So the heat itself will begin to dry your mouth. That is the first thing. It dries the mouth. Then also the smoke itself, the nicotine itself starts to stay on kakrano. Typically the inner parts of it, or sometimes even the outer parts, you see dark staining on the teeth. So those are the direct effects that you see. Then also for those who smoke, and the mouth is one of the most, so sometimes well supplied anymore. Sometimes also they have tumors developing because the cancer, mouth cancers. So smoking, we advise you begin to reduce it and then you aim at stopping. So smoking has very serious effects on the mouth and then the surrounding, as the mouth. It can lead to caries forming, cavities like caca forming on your teeth because the saliva that is in your mouth helps to clean the mouth. It also contains some things that prevent bacteria from overgrowing in your mouth and also for bacteria from progressing to, it's now dry, saliva is no more there to help cleanse your mouth, and all these things I've talked about. They tend to have high rates of cavities as well as periodontal conditions. So smoking itself is a bad thing for the mouth.
Doc, thank you very much. Ladies and gentlemen, you know, they are smoking. Very tender age, but they decide to smoke. It will affect every aspect of your health. And we are just hearing about the effect of smoking on the nenum or thirdly, there's no reason why you should do that. These are modifiable conditions. Or the people who are able to my ya for the mazi into say ensha sa men shall say asha session shall bomodin the ebeyana AJ. Dear viewers, this is the online pregnancy school. Let's go for a short break. Welcome back. Today we are talking about the mouth, dental or oral health. And we are going to now look at in the pregnant woman. We don't even know that when we are pregnant, we need to check these things. Do they have it? That's why I have a specialist, a maxillofacial surgeon with us today, Dr. Richard Salome, a dental surgeon but has specialized in maxillofacial surgery. Maxillofacial, what we name about enum. And now we're going to talk about oral health or dental health in the pregnant woman. Doc, now we're going to talk about the pregnant woman. Should we be concerned about oral health in pregnancy?
Yes, we have to be concerned about oral health in pregnancy. As I said in the past, it was thought that with every pregnancy you should lose a tooth, and but that one is these days we say is colo. You don't have to lose any tooth that God has given you, whether it's in pregnancy or it's in normal life. Now, oral health plays a key role in our body. As I said from the beginning, the mouth affects the body and the body affects the mouth in various ways. In that, when you have certain types of infection in your mouth, the body does not see them as an infection that is only in your mouth. The way the body fights, it's going to release soldiers, or what we call the body's defense systems, the immune system, to fight everywhere, because it sees that the whole body is under attack. That is why when a nail pricks your leg is not the only part of your body that develops a fever. It is your whole body that develops that fever. So with pregnancy in particular, why we must be concerned is that there are specific conditions in the mouth, which I mentioned as one of the more common oral conditions, like what we call periodontal disease. When people have this condition, in pregnancy, it gets worse. It tends to get worse during pregnancy. We'll discuss why. It tends to get worse during pregnancy. And that is why in the past, people tend to lose a tooth with the pregnancy, because with the pregnancy, the body produces hormones, which helps the baby to grow. And that tends to, one, increase the blood supply to your gums and the oral structures. At the same time, it makes them a little bit sensitive. And at the same time, it reduces your body's ability to fight certain infections around that time, even though it is helping the baby grow. So all these come together to worsen that periodontal condition. Now, with the periodontal disease, if it gets as the body being under attack, it produces various things that tend to fight infections and as well fight foreign bodies in your body. Even though it's your baby, it's a foreign body. We know now by various research done across the world and then various places, it's now been confirmed that we know that periodontal disease, severe forms of it, are associated with delivery, as well as premature abortions, as well as for the baby itself, low birth weight deliveries. So we know now by research that the mouth, what is happening in your mouth during pregnancy, can directly affect what is happening to your baby. We also know, for example, that for such people, if there are infections anywhere in your body, it may predispose you to deranged sugar control, how your body handles sugar, and then works with it within the normal ranges. So we know in pregnancy, women can develop what we call a pregnancy-related hyperglycemia. In that sense, what that means is that if you have ongoing infections in your mouth, which we already said is common, you may have that derangement there already. And we know that you can have that condition, which if usually should go away when you give birth, but then some of it persists after pregnancy. So the person becomes actually diabetic after pregnancy. So your mouth affects your body and your body also affects your mouth. We also said about eating. We know in pregnancy, a lot of women, especially during the first trimester, they may have hyperemesis gravidarum where they are vomiting a lot. In the vomiting, mind you, the acid in your stomach is as strong as the acid in a car battery. So when you are vomiting, this acid is coming out, and we know that it tends to wear out the teeth very quickly and very severely. And some of them will develop sensitivity. So you realize that some of them do not want to eat certain foods. They don't even want to eat again. And that immediately affects how much nutrition they are getting. If they've lost a tooth already or the gum is sensitive, you realize that they don't want to eat, or if they want to eat, they just want something that will not irritate their mouth or teeth. So all these things will affect your nutrition, and then that affects whether you become anemic during the pregnancy or whether you are feeding well or eating certain things. So it is important that oral health becomes a very key component. And we know that across the world, in the US, it's mandatory that you see your dentist at least once during the lifetime of your pregnancy. So it is important that we begin to make it part of our pregnancy protocol in Ghana. And I commend you for actually inviting us to speak on this. Has been a very good champion of for maternal health in general.
Oh, thank you very much, Doc. Ladies and gentlemen, I'm sure a lot of you did not even know that when a woman is struggling to vomit, we have treated the first trimester of pregnancy, and it is one of the most challenging times in the life of a pregnant woman. Busume Basa Odikano. Please visit my Facebook page, my YouTube channel, Dr. Linda Vanutu, and listen to those presentations, the first trimester of pregnancy. That is the time that this woman needs help. And if you listen to the mental well-being of a pregnant woman, which we have also discussed, you realize that those two periods, the first trimester, first 3 months of pregnancy, or yatite some cry. Mbesafuni bi ho a bibio bezibia ofe. Oside orefia acid no otide car battery. Dem an acid nitin. Se bi egu wonsa ho da ebohu. So this woman needs help. And that is why we also encourage you, if you're a pregnant woman and you are vomiting, maybe you have heard ofe mpocho men morning ya sentira bibia bezibia na refia so net ne fie foko hospital. Men ka de kwa wobeje wa to ho. Ekwo no woje to ho a wobehwe pepepe. Modo tena wumu no obe mo atena wumu, so that your teeth on chede wusintutu. Please, dental health is very, very, very important. Osende enum ya na ediba no obafa na wako. Na ebedi no onu bi na abofra no obenya na odenyin. It is really very, very, very important. That's why we are talking about it. And I'm very happy that we are talking to Doctor who knows exactly pregnant women. And even if you are not pregnant, you may be pregnant someday. You may be married someday. So please take note. If you have any question, send me a WhatsApp message on 059 242 0625. 059 242 0625. We are talking about oral health in pregnancy. The mobe ma painful wobetum wa bohon ho ban efi enum yerba ho wa bra wonyinsan no obobohon ho ban ozurukọ enyim. Doc, now you said that it will be very important that pregnant women seek dental care. What time during the pregnancy should they do that?
All right. So now there is no limit, as I'll say. There's no limit. Now there's visiting the dentist is one, and whether there's a need to do any further treatment is another thing. So to visit the dentist, as I said, there's no limit. So just as you realize you are pregnant, it will be good to go and be seen. Okay. So that if there are any issues to be dealt with, it is dealt with as much as possible. I remember, as I have mentioned, if you have any cavity, if you have all these things, at least it should have been taken care of. And I believe you must have discussed it. Typically, most people do not realize they are pregnant right from the get-go. They will probably see it months later. Yes. And so it is important that even before, once you are thinking about getting pregnant, you get yourself be seen on a regular basis so that you are taking good care of yourself and your mouth as well before that time. So there's no particular limit. It is when it comes to what can be done when you visit a dentist that we normally will put certain limits on certain things that can be done. And I believe in due course we'll discuss that.
So when they come to you, what do you do for them?
All right. So if you come to, it's interesting sometimes when and then you start asking certain questions, then it's like, but you're a dentist, why are you asking me about this? Or a woman comes. Normally when a woman comes, it's mandatory that we ask whether you've missed your period. Okay. And then we've missed certain things. It's important because then what it means is they come to see the dentist, we would normally take the history. We'll ask you questions about if you're a female in general, we'll ask you when you last missed your period. Because as we said, what it means is there are certain things we cannot be doing, especially in early pregnancy, like taking an X-ray during pregnancy, or giving you certain medications during pregnancy, or doing certain procedures on you. So it's important we know. So we'll ask you questions about you yourself in general, your eating habits, your brushing habits, how you take good care of yourself, your oral hygiene in general. And then we'll ask you certain questions about certain drugs you react to or not react to, certain drugs you may be taking or not taking. Because we know that there are certain drugs, like for example, tetracycline, which tends to stain the tooth, even if the baby is in your womb and the teeth are being formed. Mind you, the teeth are one of your face in general, and you get pregnant, by the 4th week thereabout, your face is being formed. And that includes your jaws and the teeth that are being formed. So by 7 months, all the way to the time you give birth, some teeth are already formed. They are not out of the bone, but they are already formed. And during that formation process, drugs like tetracycline can stain the tooth. That's why some people come in and the tooth is stained in a certain color. So we take that history so that what stage at which you are and advise you to avoid those ones. And then we will go on to examine you. In examining you, it is not only going to be your teeth that we are looking at. We will look at your face generally. We will check out for lymph nodes around your jaws, behind your ear, and in your neck region. Then we will look under your eyes to check whether you are anemic, you are pale, or something of the sort. We may ask you to open your mouth and close. And then just in front of your ear, there's a joint there where your jaw moves up and comes. In pregnancy, we know that some people may also have a dislocating their jaw. They will tell you they were just yawning and then their jaw locked cut. They couldn't close it again. Then we now go into your mouth to look at your mouth. In your mouth, we look at your tongue, we look at the tissues around your teeth, the gum, the tongue itself, the teeth themselves to check whether there are cavities. And then we look in your throat to check whether your tonsils are inflamed. And then the palate, we look all around these areas to be sure everything is fine. And then how much saliva you are producing, whether it is coming in or not. On the teeth, as I said, we look for cavities where signs that you may be having chemical wear to your tooth. That is when you are vomiting a lot and the acid is wearing out your tooth that fast. And then those are some of the things we will do when you come. Now, after examining you, we'll come to a conclusion and say, okay, probably you have this, or you have a cavity, or this whitening in your mouth, which easily you can just rub it off. Maybe or so and those ones will normally quickly advise you because often that is candida, like yeast kind of infection. And typically when the people get pregnant sometimes, or when your immunity goes low, or in some instances when people have HIV infection, you can have that happen. So we would normally do investigations, examine you, and then we will do further things that may be necessary things for you. And then we will choose what type of investigations we'll be doing for you.
Wow. Wow.
And then we move to
a lot is done.
Yes. So that is why when you go to the patient, somebody will come and say, I always give this analogy that when the physician sees a patient, he sees one patient at a time.
Yeah.
When the dental surgeon sees a patient, he's seeing a minimum of, if you count the teeth alone, in an adult, there are 32. One of your teeth could be cracked, one of them can have a hole, one is shaky. So you are in one patient.
Wow.
So you take your time, you can take very.
Zakura wa kampede yeshen so on your day. Shasentam, abrabo friend or kukuri bobo hona, once in we pay on doctor baby. Show a bit of hormone quacker how a banessing. A smile should be with white teeth. When somebody is smiling to you, it should bring joy to you. So if the teeth are good, you see that the person will easily share a smile. But if the teeth are not good, the person will be covered in the on yet. Let's go for a short break. Welcome back. Ladies and gentlemen, to the online pregnancy school and how the pregnant women can be affected. Mouths are very, very, very important because they are protective. And my guest is a dental surgeon trained to take care of our head, our jaw, to let us look beautiful and handsome for the young men and the old men. His name is Dr. Richard Selome. And now we are talking about pregnancy. A lot has been said. Please take paper and pen, jot things down. If you have any question, send us a WhatsApp message on 0206254206. So after you have done all these inspections and examinations and the rest, sometimes we hear that the pregnant woman should not have the tooth removed. So I don't know, what treatment do you give them? Can the tooth be removed, or what else is done for them?
All right. Some of those things that we hear are not necessarily true. A pregnant woman can have essentially the full range of various treatments that can be done. But as I said, what we normally do is that we want the mother and child to be safe. Okay. And we do not also want to expose the child to anything that can. Yeah. That is why sometimes we restrict certain treatments that we do and others. But all the time, what we work by is that we weigh the risks versus the benefit. Okay. And mind you, anything that can cause you pain during pregnancy will increase your stress levels and can also affect your pregnancy. And that is why if you are in pain and you need to extract that tooth, we can have that extraction done for you. Okay. Now, the thing is, something like dental x-rays, we would normally defer that because it's one of the investigations we would do. We would normally, even though generally we know that the level of radiation in dental x-rays are so low that research has shown that they don't normally have any effect on your pregnancy. Okay. And also, it is not directed at where the baby or the child is. Okay. Typically, they are directed at your jaw. So the pregnancy is way down, and normally you would also be protected by wearing a lead shield. Yeah. However, because especially people are worried about what is possible and what is not, especially when it is a first pregnancy. Yeah. You do not want to take x-rays during the first trimester, the first 3 months, and organs are being formed in the body. And that is where, if anything can go wrong in terms of having clefts develop, those are the times that do that type of investigation in a woman who is pregnant of pregnancy, provided it is necessary. That must be done.
Thank you very much, Doc. And I'm sure also given if the woman needs, but he has told us that some of the medications, they are very careful when giving a baby. We have heard that it is not just the mother who will suffer if there's any problem.